Forget about a zero COVID policy, right? There's no eradicating the virus.
No, there is no, thank you for having me here. I don't believe that it's going to be possible to eradicate the virus. We see it in animals, we see it in cats, dogs, hamsters, and that makes it really difficult to eradicate.
So we have the likes of the UK, Ireland, Denmark, all trying to live with the virus. What does it entail? What should that strategy look like?
So thank you for asking. So I would really like to see a lot more treatments and to see a real pivot towards treatments. I worry about long COVID, and to have accessible, especially cost-effective treatments for people who may become infected with COVID, because you can be vaccinated, you can be boosted, and you can still contract COVID. So I would really like to see a real pivot towards treatments and cheap, accessible treatments whereby people can be treated on an outpatient basis to prevent long COVID. Because long after this pandemic, this wave will be over, I don't want to see another wave of long COVID. So I'd really like to see a pivot towards more treatment. So the EU approving Pfizer's drug is a step in the right direction.
So you're after accessible, more affordable vaccines. Where are we on that?
Well, the vaccines, I think here for sure, are free. They are accessible. You can make appointments quite easily. They are being, I know the Biden administration has sent more vaccines to the developing world, and I think this is incredibly important. There are a lot of people around the world who are very vulnerable and have not even had their first dose of vaccine, so I think this is a really good thing. And there are new vaccines in development. I really would like to see new vaccines, maybe even a pan-corona specific vaccine that would work against all variants. And there are some mucosal ones that I think have a really good promise. And so I would really encourage more vaccines to be developed, and also treatments, because vaccines take a while to develop, and we need treatments.
Christina, I mean, you know, China having this zero COVID policy, now it's actually called dynamic clearing. Is the problem there a form of national pride, and pride coming before the fall, because their vaccines, indigenously made ones at least, just aren't doing the job? Right.
Well, as we've learned, Omicron is incredibly hard to stop, even for Pfizer and Moderna's quite effective vaccine. So I'm glad that China is trying to develop new vaccines. They've published their phase 1 trial. It was large for a phase 1 trial, but it's still not very large. And they didn't, at least in the paper, I did not see how it performs against the Omicron variant, which is the variant that, well, actually there's 3 subtypes of it, that is currently taking over the world. And so what is not known is how does this vaccine fare against the Omicron variant, and will it be enough? Yes.
Christina, very quickly, it was interesting what you said about animals. Now, you're saying there's evidence that humans can transmit the virus to animals such as minks, I think cats and dogs as well, white-tailed deer, but there's no evidence of them passing it back to humans. Does that then, very quickly, eradicate the bat theory in Wuhan?
No. So these variants are different. The ones that are infecting the animals seem to be, you know, they've evolved further along than the original wild type strain. So I'm going to say that I'm not sure. But we have seen it in domesticated animals and also in zoo animals as well.